Antifungal medications. So antifungal medication work with the very systematic way. First of all, we have to consider a fungal cell. So this is a fungal cell, and in this cell there is a nucleus. This is cell membrane, and in the outer we have the cell wall. So the composition of the cell membrane is very much important regarding the effect of antifungal medication. So ergosterol, it is a main component of cell wall of the fungi cell, and made it is made by a series of chemical reaction. First, the precursor molecule is the squalene, and squalene is converted into squalene epoxide by an enzyme. Squalene is converted into squalene epoxide by an enzyme epoxidase. And then this epoxide is further converted into ergosterol. So first enzyme which we can target for inhibition of fungi cell is squalene epoxide. So the medication which affect squalene epoxide is terbinafine. Terbinafine inhibit epoxidase, and it is best for cutaneous fungi, especially the dermatophytans. So squalene oxide is inhibited and the cell wall synthesis process is stopped over here. The next medication, after squalene epoxide formed, then the squalene epoxide is converted into lanosterol, and lanosterol is demethylation demethylated by the demethylase enzyme, and it is converted into ergosterol. So in order to inhibit the cell membrane synthesis process of cell wall, in order to kill that cell wall, we inhibit demethylase enzyme, and the drugs which affecting these demethylation process is azole. So azole includes fluconazole and itraconazole and clotrimazole and vori and isavuconazole. These azoles are very much important. So azole inhibit demethylase 14 alpha demethylase enzyme and inhibit the synthesis of ergosterol. So when there is no ergosterol, no cell membrane, the cell die. So the various classes of various parts of this various drugs of azole family include fluconazole. So flu is very much effective against candidiasis and also for AIDS related cryptococcal meningitis. Then clotrimazole is for cutaneous fungi, and itraconazole is for systemic mycosis, especially the histoplasma, blastomycosis, coccidioids, And then Vori and Isavo is very much typical for aspergillus. uh, so Voriconazole and Isavoconazole is for aspergillus, and Isavo is especially effective against mucor. And the side effect of these azoles is very much common, especially the gynecomastia, because they interfere in the production of certain hormones, especially in the uh, adrenal gland, gynecomastia. And also the azoles are the P450 inhibitor. That's why they goes into the liver and cause dysfunction or hepatic dysfunction. So two classes, we have discussed two classes. The next one is regarding the cell wall. So for the cell wall, we give the cell wall, this is a cell wall, and we give third medication, echinocandins. So echinocandin, for example, Caspofungin, they inhibit beta glucane, which is a important component of cell wall. So echinocandins, they inhibit the synthesis of beta glucane, and they are very much effective against the invasive aspergillus and candidiasis. So we have discussed 1, 2, 3 medications. The next medication which affect the fungi survival is the medication which affect in the nucleus. So there are fourth and the fifth medication. So the medication affecting the nucleus includes, first one is griseofulvin, and this griseofulvin, it affects the mitosis process by affecting microtubules and affect mitosis in the, so it affects on the microtubules, and when we interfere the mitosis process, then the cell eventually die, because there is no mitosis, no replication, the cell can't survive. So it is very much effective against cutaneous fungi. And the side effect of this, it is griseofulvin is also P450 inhibitor, and goes from the liver, cause liver problem. Also it can cause teratogenicity, carcinogenic, because it's affect the human mitosis process. That's why it's carcinogenic, teratogenic effect, and also disulfiram like effects. The next medication which affects in the nucleus of the fungi cell is flucytosine. Flu means fluorinated, cytosine mean nucleoside. So it affects it, flucytosine converted into 5-fluorouracil, and this 5-fluorouracil affect the purine and pyrimidine pathways in our genetic section, biochemistry. And if the pyrimidines or nucleosides are not formed, then there is no DNA or RNA synthesis. And if the DNA and RNA are affected, then the side effect is bone marrow suppression. Not only kill the fungi cell, also in the acute doses, large doses, it can causes bone marrow suppression. After flucytosine is very much effective with synergism with amphotericin B. We use this with amphotericin B, and it is effective in systemic mycosis. Then we have Nystatin. So the next medication which causes pores, so we have discussed this, flucytosine. The next medication which causes pores in the which can cause pore into the cell wall of the fungi cell is Nystatin and Amphotericin B. So first, a little information regarding Nystatin. And Nystatin has a similar Nystatin and Amphotericin has a similar mechanism. We'll discuss later in the Amphotericin segment. So for Nystatin, we use this Nystatin in diaper rash, especially those mothers which are not aware of the rash problem regarding in their babies. So they generally use like steroids for the rash problem. So in my preference, we have to go for the root cause of the rash problem in the diaper rash problem in the children. So I prefer that we use Nystatin rather than steroid, because steroid has a lot of different side effects. So always ask your doctor for medication for prescription. So for diaper rash we use Nystatin. For oral and vaginal candidiasis we use Nystatin topical, topical creams. So after Nystatin we have the major class, amphotericin B. Amphotericin B tear or make pores into the cell membrane, which makes the cell to leak the fluids and electrolytes from the cells. So amphotericin make tears. So there is a change in amphotericin. The main side effect, amphotericin is used with synergism with the systemic mycosis, and it is used for very serious like meningitis and systemic dissemination of mycosis. And the side effects are very much common and very much tested. So the first side effect is amphotericin can cause bake and shake side effect like high fever and chills, and it is infusion related side effect. We can treat this by giving antibiotics and sportively treat and reduce the infusion speed of the dosage. Then we have a dose dependent effect, dose dependent nephrotoxicity. First most common side effect, nephrotoxicity. Monitor RFTs in the patient using amphotericin B and are seriously ill. So dose dependent nephrotoxicity, they change the permeability of different electrolytes, especially the potassium. So next side effect, hypokalemia. Hypokalemia leads to arrhythmia. Then also they can lose magnesium in the kidney, magnesium loss, and it can cause nephrotoxicity dose dependent way. Then the pores make and leads to fluid leakage, and this fluid leakage leads to hypotension, and also the kidney is affected. So there is no erythropoietin, so can cause anemia, and also it can cause phlebitis, IV phlebitis. So these are the general information regarding how an antifungal drugs work.